I'm Angelica. I'm gonna be doing my patient's primary IV bag, and we're gonna do a normal saline. I've done my first and second check of the Pyxis with the MAR. I've also done my pre-assessment, checking for any contraindications like heart failure or kidney failure, and any allergies as well. I've done all my rights, and so I'm gonna come into my patient's room to do my third check and patient identification. Hi, good morning, Jennifer. I'm Angelica. I'm going to be your nurse today. I'm here to give you some fluids the doctor has prescribed for you. Let's go ahead and just do some hand hygiene. I brought in some normal saline to put through your IV line. Do you have any allergies? No. Okay. Can I verify your name and date of birth? Awesome, thank you. So at this moment, I'm going to do my third check with the MAR, and so normal saline, and the doctor has ordered 100 mLs an hour, and we have 250 mLs here, so which I already checked. I'm going to go ahead and check your IV line. I'm going to raise your bed. I want to make sure there's no signs and symptoms of infection. And have you had any pain on your IV site? No? Any discomfort, redness, or swelling? I'm checking for that as well. Extravasation or infiltration. And the IV line looks okay. Now I'm going to check for IV line patency with my IV flush. And I'm going to make sure it's not clamped. I want to go ahead and scrub this with alcohol for 15 seconds and get rid of my bubble. I want to aspirate for blood return and then flush to make sure there's no blockage. I'm going to leave this here to keep my line intact, and I'm going to grab my supplies. These are recycled, but they've been new. I have my primary line, and so I want to make sure I close my clamp. I'm going to make sure I close my clamp, and before I spike my bag, I'm gonna go ahead and spike my bag. This one's open, but it would have had a cap before. And in my bag, I'm gonna turn on my pump, and we want to go ahead and prime our line. Squeeze my chamber. I want this 1/3 to half full. Over here. And this one's recycled, but I want to make sure there's no air bubbles in the line. And because it's recycled, we're going to have little technical difficulties. Alright, so my line is primed. And I'm going to go ahead and put this in my pump. So we want to set up our pump, channel select, our IV fluids, and we're doing 0.9% normal saline, and this is correct. Our rate is 100 mLs per hour, and we have 250 mLs to infuse. And we're going to go ahead and connect this to our patient before we start. And this would have a cap as well because it's new. And now make sure all my clamps are open. And we're gonna get ready to infuse, start. And we're watching for our first drop. and make sure that it's running fine and the pump doesn't alert us if there's any problems. I'm gonna go ahead and bring my bag down and do my patient teaching. So with these fluids, you may have an urgency to go to the restroom if you want to pee. If you feel any swelling or any shortness of breath, please let me know, but I'll be checking in on you. Do you have any questions? No? Okay, here's your call bell. Let me know if you need anything else. I'm gonna go ahead and make sure that I label my tubing and my bag before I leave with date, time, and initials to hand hygiene and documentation at the end.